Okay.
Maybe we'll get Wendy making one of her killer facial expressions that'll.
I'm sure.
So what I can share is about my journey with my broken tooth.
Yes, love to hear about that.
All right. So I broke my tooth from a car accident, and I've been dealing with the insurance company, and they have been kind of going back and forth, just doing their thing as, insurance agents. And I've been trying to send them doctor's notes about, the diagnosis. And the notes haven't been working because they've been on white paper, so she hasn't been able to read them. And the notes from the doctor are very small and, kind of garbly, so she can't read them. So after about a month and a half of going back and forth with trying to send her notes and, my expense records and all that kind of stuff, she calls me last week and says, I just want to talk to let me just talk to the dentist because I can't read it. And in order for me to pay for your root canal and what's going on, and weeks before, she said she probably isn't going to approve of this. So like going back and forth. So finally she decides to call the dentist, and I haven't heard anything yet. So I'm waiting, and I had my root canal last week, which normally, a couple of years ago, I would have been a wreck. Like, I'm having a root canal. Oh my God, I can't believe me. Why am I having a root canal? What did I do? Like, oh my God. So I went to that root canal, no problem. And I went through the whole procedure, no problem. It really wasn't that bad. It really was not bad. And people, talk about how awful these root canals are. And it was nothing. It was nothing. I mean, I heard him drilling. Really, what bothered me the most was the noise.
Yeah.
And he put a rubber sheath over my mouth to protect the rest of my teeth. So that was the most inconvenient than the actual, the actual procedure. So I'm like, this is really cool because now I got to experience a root canal, and I can tell people, I can share my experience with people about having a root canal. And that's my mindset now with all the things I experienced with this car accident. This is a journey. It's experience. It's wisdom. It's not anything for me to fear. It's not something that I need to be anxious about. Is, I'm a grown woman now, and these things are going to start happening. So I find that really, pretty wild in comparison to how I might have been 2 or 3 years ago.
That is so cool. That is so cool.
Yeah. Yes. And then last week I was working with a client, and she had like a little trouble with her daughter. Her daughter's on the spectrum, and her daughter had gotten a little injury. So I started to go into that spiral of like, oh my God, do I have to call? Do I not call? Like, and then and it was like a week later after she told me about the injury. And I'm like, no, Elaine, because it was an accident. It wasn't a form of a, and I'm just like, I noticed myself spiraling again because that's been one of my major issues. I'm like, Elaine, you just got to stop this. You just got to stop. And like, it's going to be okay. You're okay.
You know what? I was just going to say, I love that it stopped even before you said you just have to stop this.
Right.
Because the realization, boom, stops it. Wow.
Yes.
How cool.
Yes. Very cool.
How cool is that?
Very cool.
So it sounds as though you're listening to wisdom more and more and more.
Yes.
And not all the brainwave, personal stuff.
Yeah, a lot of the brainwave and the personal stuff is pretty gone. It's gone. Like, I don't feed into it. I don't feel it like I used to. And I'm just being. I'm just going about my life. Just going about my life. That's it.
Did you say brain waves?
Lori
I
said
did say
brainwave.
brainwaves, and I wanted to ask you as a nurse, Wendy, is that how thought comes through the brain waves, the brain?
I don't know. I don't even know what a brainwave is. That's what I was asking.
Oh, maybe I'm calling it wrong, but you know, when somebody is in the hospital and they're like coming in and out of coma or something like that, and they're checking the lines. Oh, so there are waves for heartbeat and also waves for brain waves, I thought.
Yes.
No, yeah, you're right. So can you draw a line between electronic picking up of brain activity and Elaine's life before when she was consumed with brain waves? That's where I'm.
I was using brain waves as thought.
Mhm.
You can't see thought. You can feel it. You can feel the thought you're having,
Mhm.
but we can't see it except for a wave on a machine, brain waves. I don't know. Is that how thought gets transmitted through the brain, the physical brain? Like there's formless energy, the ability to think coming through the form of a brain, creating thought.
I don't know. I don't know where I've heard of hardware and software when it comes to this understanding, like the brain. It's sort of like hardware and software are neutral. They're not, was another word for it. They're agnostic, right? But when we have a thought come through, we label it good, bad, helpful, not helpful. And that's more of a belief system or a psyche or something like that, rather than the processor, if you will, of the brain. So
Hmm.
yeah, I don't know. It's a good question.
All words
Sure,
pointing in the same
there's something
direction.
that's creating that content. I don't know.
And then we have the ability to think about the thoughts we're having. That's
Mhm.
why people say, "Oh, wow, they get afraid when they feel fear, or they get down when they feel depressed. They have a
Mhm.
depressing thought, and then they get down about that, and then they get down about the fact that they're down." It's
Yeah.
all the meaning we put on things, but that's so beautiful. What you said was you have a whole new meaning for this is just part of the journey.
Mhm.
This is just what life is bringing me next. It's
Mhm.
not an oops, it's not an up, it's not a down, it's not a sideways. It's just the next step.
Mhm.
Neutral.
Yes.
We're the ones that put the labels good, bad, scary, wrong, all the judgments.
Mhm.
Right. Right.
It's just kind of like, I don't know, making this up, making it all up, right? Secondary thinking, like we can think about what we think.
Mm-hmm. Meta-analysis, right?
Yes.
Get all meta on it. Observe the observer. Yeah.
Mhm.
Yeah.
Wow.
I don't know if it was Christine or somebody in the last 48 hours. I'm sure I've heard these words before, but they really landed well. That 100% of the time, this is just a different, for me, a different way of hearing it. 100% of the time, we are feeling our thought in the moment. We're never feeling reality.
Mhm.
Correct.
And I was like,
Mhm.
Correct. Yeah.
Yeah.
Now, why is that so huge to know?
because that's
You'll
malleable.
know it's huge. What, Wendy?
Because it's malleable. It's not fixed. And we have some wiggle room, some choice.
Yeah.
But the hardware and software does it always the same. It always has a physiological brainwavy thing that's how it comes through that way, but then we assign meaning to it. Back before I learned about the principles, I heard the expression, which made a lot of sense to me then, is that human beings are meaning-making machines. That's what we do. We are machines, and we make meaning 24/7 out of everything. I wake up with a cramp in my leg and I go, oh my God, I must have a deep vein thrombosis and I'm going to, die of a stroke. And somebody else might go, I should have done all those push-ups. And somebody else might have said, I'm turning over and I'm going to change my position, go back to sleep. There's 5 million ways to respond to a cramp in my leg, right?
I
But we,
love that. That's a great metaphor. Yeah.
but we make meaning out of it
Analogy.
all the time. That's what we do. That's what we do. And there are some people that make meaning, and it's always, or a lot of times, it's scary and worrisome, and we call those people as having an anxiety disorder or depressed, because the way they make meaning out of things it's not very joyful, not very easy, not very light, not very temporary. It's all, you guys will know these words. My sister told me these words years ago. When something is pervasive, permanent, what are the P's? Like there's P's, more P's. It's like the sign of somebody that's actually depressed. If everything looks permanent, pervasive, I don't remember what the other one, 2 words were. I think there were 4. And it just was about being negative and living,
Pessimistic.
yeah, pessimistic, maybe something like that. Yeah, I don't remember. But anyway, it made sense to me. I was like, yeah. And so, so just before I came to meet with Lori at 11:30, I was on a live presentation by a woman who's in the 3 principles world, and her song sheet that she sings off of is about menopause and perimenopausal symptoms and menopausal symptoms. And I lost what I was going to say about it, but bottom line is she basically just says it's a very normal thing in life, and we have taken it and medicalized it and awfulized it. And oh, she said, this is what she said. She says, so many women in this world of menopause and oh my goodness, I've got the brain fog. I'm in menopause, I've got the brain fog. And she said, I wonder if brain fog feels like overwhelm or exhaustion. I wonder if it's because you're on social media a lot and you've got 4 kids and you've got a job that's full time and your mom's in the hospital. Those are things that can pile up and are probably, and the brain fog might be your body's way of saying, could you just sit down, take a deep breath, have a bath, go get a cup of coffee, turn off the TV, whatever. But we're calling it brain fog, and I need hormone replacement therapy to help me clear my brain fog. And, all these, I don't think she says it quite so frankly to a group of new people, but I think to me, one-on-one, she might call it a scam by the American Medical Association or by drug companies that, great, let's make a pill for that. Just like with
Charge
chronic pain.
$500.
Yeah, let's make a pill for chronic pain. Let's do this, let's do that, let's do it. We've pathologized so much in life, and we've pathologized life. And Sid Banks said, no need. Life is life. Throw the tape out the window once you figure out that life is life, and you're not always going to feel like you feel this minute in 5 minutes. If you just take your hand off of it and stop mucking around, it will always fluctuate, change. Yeah.
Yeah.
And it's a whole different way of looking out at life, right? And it feels like, oh man, my eyes are finally turned in the proper direction.
Mhm.
Because it just makes things so simple, so much simpler and so much easier to, we feel when we start freaking ourselves out about stuff. That's the signal, not the content of what's freaking us out, but the feeling. He's letting us know we don't know what the content is. We're making it up.
Mhm.
I mean, you have a broken bone. You can look at the x-ray and say, oh yeah, that bone is broken. But all the other stuff around it, we don't know. Are we going to heal better than our neighbor healed? Or are we, going to have quicker healing than most? Or are we going to have slower healing than most? All that stuff that rather than, oh man, it's a nice day out. Okay, I'll take care of the broken bone and I'm just going to enjoy what I can
Mhm.
and be
And
grateful it was only one bone.
right. And the
Right.
bone is obvious, but I guarantee you, in the time when the three of us have been on the phone or on the Zoom, we have breathed in things that are not healthy.
Yeah.
And our body has taken care of it. And that happens all day, every minute. Things are being neutralized, eaten up, chewed up. The white cells, the cilia in our nose are, filtering out bad things all day, every day. We're warding off disease all the time.
Mhm.
But when something obvious happens, like a broken bone or a broken tooth, oh my, I don't know that we can take care of that. And you're like, yeah, you can. And it might be the wisdom of the body might say, get thee to a dentist. Yeah.
Yeah.
Wisdom directs us. It's always there leading us in the right direction when the brain is quiet enough, when we're not in the content of our thinking.
Mm-hmm.
Like Wendy said earlier, the content that comes and it goes, it's not permanent. Yeah, it's malleable. It's not permanent. It fluctuates. New content is always coming in. I
Right.
never remember the number of thoughts we have. It's like 70,000 a day or something like that. Crazy.
Yeah, right.
Who counted it?
Right. And the other thing is that we are also quite clear and quite knowledgeable about. Now, I never had my own children, but I've been around children. I've babysat. I have nieces and nephews. I've taught Sunday school, whatever. We know to a child when they are upset about something or they fell and they skinned their knee and they get a Band-Aid on it. We watch them move through. We know that the human spirit moves through. A baby falls 47 times before it stands up the first time without falling, or 147 times, whatever. So we've all witnessed it, and we can say, oh, they're there to my 5-year-old child. It's okay, this, to have a good cry about your knee and let's put a Band-Aid on it and get you back outside. We know that it works like that.
That's the difference.
Mhm.
Knowing how we work
Mhm.
inside out.
Yep.
That's what makes all the difference in the world. I mean, your story, Elaine, is just so powerful. How it used to be before having this understanding.
Mhm.
Yeah,
Um,
I mean, that's
my,
the
bo-
majority. Wendy,
my boss is texting me, so I'm gonna have to go.
all right. We'll see you. Have
Bye.
a good work
Feel better.
day.
Thank you. Thank you.
You're
Bye-bye.
welcome. Bye.
Yeah, Wendy's got this nursing job. It sounds like she's in administration at that level, and
Mhm.
it plus they don't, I don't know, they're getting really, really busy. So yeah, I told her she's got to tell her boss she has to hire more people.
Yes, for sure.
We only have 2 arms, 2 legs, 2 ears, 2 eyes. You know, we have our limitations. We can't be taking
Absolutely.
on the job of 3 people.
Yes. I can totally connect to that. Totally.
So, what do you want to talk about for the next? We got a few minutes left. I could also turn off the recording if there's anything private.
Sure. It's up to you. I'm good either way.
Okay. Well, as long as it's not private, we might as well leave it on and see what comes to us. What's going to be useful? What'll be helpful for the community in
Mhm.
mystery school to know about? You know, it started out, and it still is, all about, you know, for people who are listening to or curious about what's this hubbub about Sid Banks and the 3 principles. That's why I got this going
Mhm.
a few
Yes.
years ago. I think the most people we've had on the screen in the, you know, at one time might have been 5 at most. Yeah, there's never a lot of people. There's over 100 people in there, but you know, they're in different parts of the world. So that's why I
Right.
recorded also.
Oh, sure. Yes. Yeah.
And like Wendy took another 3 principal practitioners course on Insight Timer this morning. You know, we're all listening to each other in different courses, webinars, what have you.
Mhm.
So it's a beautiful cross section. Because then, I mean, I don't know how many people are on 3PGC, thousands. I wonder if they post that anywhere, how many people are there. But that would be a cool thing. You know, and that's how it spreads. Wendy calls it rippling it out.
Yeah. Yeah. It's a great word. It's a
I
great
mean,
experience.
go, Willing. Yeah, say
It's
again.
a great experience because, you know, you're getting to meet so many different people and their perceptions and their you know, their ideas and feelings about the 3 principles and how they apply it to their lives. I find that really, really very dynamic. And it just solidifies, you know, more and more about the choices, you know, and again, just how we feel and how we reflect about how true it is, like how just being able to live our life in a very natural and, you know, without all of this, you know, all of this hullabaloo, like there's just so much, and we don't have to respond to it. We don't have to have a reaction to everything that we hear, everything that comes to our mind. And that's like a really a huge part of it.
I love that. I got an image of a filter. It's like this imaginary filter in our forehead.
Yeah.
Filter between our 2 ears, everything we hear from the news, other people, and everything we hear from ourselves. We have choice.
Yes.
You know, I told somebody the other day that I'm taking a sabbatical from the news. It's just too overwhelming for me, you
Mhm.
know. And you know what the person said to me? They have not listened to the news, and this is a smart man who does good work in the world, really good work in the world. He said, I haven't listened to the news for 7 years. I mean, I'm kind of addicted to knowing at least headlines. Uh, I don't know if I could give up. I just realized I'm going to ask him if he doesn't read headlines. How can you not read headlines? The headlines are the scariest.
Well, I have a different perspective. I don't live by the news, but I find the news and the people who are sharing the news and or the subjects of the news, I find it really interesting because I'm watching their behaviors. I'm listening to what they're saying and trying to look at it in terms of their own personal journey. So how they are how they present themselves, how they create their own realities because they're on display. So I try to apply what I'm learning with the three principles and how these people are behaving. And that's really how I've always been. I've always been an observer, always, even before I decided to go into the field. Even as a little girl, I would just watch people. And I found it so, I'd go to a restaurant with my friends or family and I just watch people. And people at my family's trying to talk to me. And I'm like, I'm so absorbed by what's going on because I find it so interesting. It's so, I, I don't know. Like I just always have had this interest in what people say and their mannerisms, how they use their hands or their bodies. And so that's how I look at watching the media, whether it's Facebook or whatever. It's like, this is so interesting how people are responding, what their perception, like to all this that's going on around them and what people say, the feedback that is being given. It's just incredible. And
Elaine, I love that. Because I'm listening to you, I realize I do that too. But
yeah,
hearing you put it to words is really wonderful. It's wonderful.
yeah.
Yeah.
So I've been able to do that so much differently now because I would personalize it. I would this whole thing with the politics. I would or all the rules that are changing as far as women's rights. Like I would be freaking out. I would get so upset. But now I just look at it in terms of this is part of life. This is part of the journey that everybody is on. And I can speak to how there's these different trends and it keeps changing. But then sometimes it repeats. There's a repetition about some of these themes, if you will. And that's adding to my wisdom, which I can then share with people because I become much more alert and aware of these trends
Yeah.
and kind of feel like because there's repetition, it's just a whole nother, we use the words millenniums, we use the word baby boomers. Like, well, what that really is about is based on our age and what we've experienced during those times. Like,
Yeah.
and it's going to end up repeating itself because you can see that there's some things based on my time and or my older folks' time to now, and some of it comes back and some of it doesn't. Like I'm just so I'm just like blown away by it.
Right. It is mind blowing. And to think that humans are still walking the planet. I mean,
Right.
look at all that's happened in history. It's absolutely mind boggling.
Isn't it though? Like, yeah.
And like we think we have it bad.
Right.
We're not burning people at the stake.
No.
We're not putting leeches on people to make their
Better.
illness go away.
Right. Right.
Bloodletting, right?
Right.
So what's a journey? But it's a journey that is evolving. And
Yes.
sometimes it seems like it's such a huge setback. My God, these wars. How could we be set back so far? But like you say, it's, there, we don't know. How do we know there is no end result? Because evolution is infinite.
Exactly. Exactly.
We think we know what's right, what's wrong. You do your best to live the best life you can and to offer the best you can for other people.
Exactly. Yes.
That's all we can do.
Exactly.
And sometimes the best for other people might be to, what's that word? I used to be like that, which isn't bad. It just, can upset the people who don't see it that way. An activist.
Mhm.
I'm not saying that it's bad to be an activist when you believe in something, but there's a way to do it without anger.
Yes.
Education without the anger, because the anger is what pits people against people. Right.
Yes. Right.
So just being able to communicate, right? Two really very different people, it can sit and communicate their view without taking it personally. It doesn't mean they have to change views to have the same as the other person, but it's not a personal front that
Mhm.
somebody sees something differently.
Yeah.
So, they're talking about how they, I've said this also, whoever they are, we're all part of they. Doesn't it feel like as we all get ourselves more healed, you might say, or more with it, or more um, functioning at a higher level of consciousness, like Wendy's word, it ripples out and that raises the level of consciousness of the globe. I
Yes.
mean, did you see on Mystery School the people in this novel, Navahali? I don't think I'm pronouncing it right. It's a tribe. Navahali is a tribe. I think that's how you say it. Yeah. Um, they are curing alcoholism, abuse, you name it, through this understanding of the principles. There's a video,
Oh,
it's down a little bit now, but there's a Black woman in a blue dress sharing her experience.
wow.
Yeah.
Wow.
Yeah, I remember they sent out a something to get books, and they sent out like a fundraiser. I can't remember what they call that, in order to stock this village with books. Well, the Three Principles books is,
Wow.
Second Chance. It's beautiful because Sid wrote in such a way that anybody in any part of the globe could catch on.
Yeah, he wrote it from like, from the inside out. He wrote it not like it's not a professional book. It's not like, here's this means this and this means that. It came from his own wisdom. It came from his, I'm going to say, soul.
Yeah, yeah. I would say that. I would use that word too. What a
All three of
beautiful
the
word.
all of those three books, that's genuine, that it's sincere, not a professional book about education. It's just a sincere books. That's what makes it so easy to read over and over and over again. And each time you read it, you always find something new.
Yeah. Isn't that wild? Did you catch wind of his book, Dear Liza? It's
No.
a tearjerker. Oh, it's such a tearjerker. It's incredible. Some people say it's his best.
Oh,
It's
okay.
really wow. And you wonder, how did it takes place in the last century in England.
Oh, wow. I'll
How
have to
did
grab that one
he?
too.
Yeah, I got to talk to people in the community, like Alan Flood. I wonder if Alan or Jim Beck, I'll ask him. I'll start a communication. That question just came to me. Did somebody do some research about what it was like to be in poverty or, is it a story he just made up? Uh, yeah. But it's also centers around a general, a retired general in the army
Yeah.
who meets up with a street urchin, a young girl whose mother is ill, or I don't know if she's ill. She gets word from her. I can't remember. It was a long time since I read it. And the letters, because she gets handwritten letters from her mother, but she's on her own, living in the streets, taking care of her younger sister. And
Wow.
she herself is like, I guess she's like 11. And she's taking care of her, I don't know, 6, 7-year-old sister. And she meets this general, and I'm not going to tell you anymore. I mean, it's
Okay.
beautiful. It's incredible. I want to cry just sharing this much about it. And the letters that the mother writes to her. I got to go back and read Dear Liza.
Wow. Yes, I'm gonna pick that up. Wow.
Yeah. I'll put a little link in Mystery School for people. Yeah.
Okay, cool. Wow.
Love these discussions. We never know. Think about a journey right
Right?
here in 1 hour. We had, I'd say, what a beautiful journey. They're
Yes,
always beautiful.
they are. Absolutely. That's why I love to come.
Yeah. Even when you're retired in New Hampshire, you won't be retired though, but you'll be in your retirement home, working more than ever, but
Right.
in the best way,
Yes.
right? Isn't that like a dream? Like, I'm never going to stop working, but I'm not going to be dealing with insurance companies.
No,
That
neither am
whole
I.
thing.
Nope. Nope, neither am I.
Aren't we lucky that we're
Yes.
at this point in our life?
Yes, this is
And
another impasse for us. Absolutely. We've done our due diligence and it's time.
may the next generation see how to not have to do due diligence.
Right.
All of
Exactly.
a sudden, all these youngsters, they're finding ways to make a living as solopreneurs,
Yeah.
even playing video games. There are these kids
Oh
playing
my
video
God.
games on Zoom, and the
Oh,
world watches, and they pay them salaries.
yes, my daughter was just on that before I joined. She was just watching these guys play these weird, I don't know, they're collecting equipment to give to their sergeant or something, and they're making money, and the people who are playing it, just you could see they're just making money, money, money. I
But
have a
that to
client,
me, that sounds like reality TV to me,
doesn't it
when
though?
they're at least filming something that's in life that's really happening. I, yeah. So if
Yeah.
1 million people pay them 2 cents or a dollar, there you go.
Yes. My daughter watches a woman who has her own nail polish. She makes her own nail polish brand, and she's like, it's just incredible. I'm like blown away by it. And my daughter got caught, and she's got like 10 boxes of nail polish. Like, okay, and she's doing her nails, and her nails look beautiful. So it's okay because she's enjoying herself. She's having a good time, taking really good care of her nails. But this woman is like, a billionaire now because of what she does. Like, can you imagine how creative? How creative is that?
It really is. And in fact, I'm going to message Wendy to listen to this. because what you just described, we'll share it at some point, but this is going to inform her in the direction she's going in.
Okay. All right, cool.
I can tell you the name of the program. It's called Insight Timer.
Oh,
Insight Timer. I never heard of it before. And did you have a few minutes to stay on a little longer? Okay.
yes.
It's a great example, personal example of me using my thinking rather than my wisdom. Okay.
Okay.
So Wendy's been telling me about this. She even just took it like a 5-week or an 8-week course, how to get on Insight Timer. It's, an app, a phone app. And I said, Wendy, this is a meditation app. I'm not teaching meditation. And she said, well, I'm not either. And she explained, but whatever she explained, and I thought I was listening. Well, it took like 5 conversations until something clicked. Oh, that's what it was. Wendy sent me a link where I could see other 3 principles people are there. They're not teaching meditation, but there's a lot of people who want to learn meditation, and then they get upset when they have a day they don't have 20 minutes to sit for meditation. And they don't understand that they're getting upset is not coming from not being able to meditate one day. It's coming from them thinking that this is bad. They can't meditate today. This is going to affect them. And something clicked, and I realized, oh my God, it makes perfect sense. So Wendy is helping me get on there. And I'll tell you what, I love doing it because I wrote up what I want to share. It's only a 20-minute track. That's all it is. And I got a microphone. I'm like playing. This is play. And you do it all on your phone. And she's going to show me how to upload it. I am like tickled pink.
Oh,
It's like we're in
wow.
a sandbox together as kids.
Yeah.
It's not going to make money for us, but it could at some point.
Of
We're
course
doing
you could.
programs together. We're doing a program for 7 people. We could do it for 70 people
Of
or
course you could.
700.
You can stream it. You can go on a stream. You can go on TikTok. I forgot the other stream. Oh, what's the other stream called?
We're going to hire your daughter. We're going to hire your daughter.
Okay, that's she's graduating. Communications.
Communications.
Yeah, her degree's in communications. So that would be perfect.
Or tell her that she's got a job, but she's got to graduate and really learn this. Like,
Yeah.
she's really smart. She's already getting A's, right?
Right,
She's acing it
exactly.
all.
Yes.
I'm so thrilled. New Hampshire, here we come, right?
Right, exactly.
Oh, anywhere. That's what's incredible about this time in life.
Yes,
We could work
absolutely.
from anywhere.
Yes, exactly.
This has been wonderful. It's so great to see you. And I'm saying, nobody will know that you had a root canal. Look at how gorgeous your teeth are. They're all beautiful.
Yeah, the front ones are
aligned.
awesome. The front ones are great. You never know what's going on in the back.
I can say that for a few things: my house, my body, etc.
Right, exactly. Exactly.
Okay, Elaine, great seeing you, and
You too.
see you next, if not before.
See you next week. Have a good one. Bye.
Bye. You too. Have a great one.